If you ask anyone who works with Margarita Yepes, they will all tell you she's the hardest working woman around.
I am from Medellin, Colombia, South America. Came to the United States over 40 years ago. I work for the Trademarks Hotel here in St. Petersburg Beach for 31 years. I'm the Director of Banquet Operations and Logistics. I get to work between 4 and 5 o'clock in the morning. I need to check all the meeting rooms, meeting space, that everything I've done the night before. I'm in charge of all the events, activities, and anything that has to do with the conferences, all the events at the hotel. I'm on my feet, an average of 12, 15 hours a day, 5 days a week, sometimes 10 days. It all depends on the business of the hotel.
But her degenerative pain turned the simple tasks of just going to sleep and waking up into a nightmare.
My pain started about probably 25 years ago. My pain was in my lower back. It felt like, it's kind of funny to say that, but my mother used to use this expression, it's like a chihuahua was attached to your back, like a dog bite. And nothing would take it away. No heat, no cold, pills. It was excruciating. Continuous pain. When I would have to get out of bed, I would have to go like this, wait there for a few minutes for my back to be in comfortable position. Then I'll have to grab this arm like this and go, oh, like this. And I couldn't turn like this. I'll have to be like a little bit, pick up my legs in here, wait a few minutes. Then I'll have to, little by little, do one leg, then the other, and then I'll be like, oh. And then I will sit in this position for a while, take a deep breath, and I'll have to go like, and then straighten out. But then when I get to this place, then I'll get up and I'll be like this. I couldn't be straight, so I have to go like this to the shower until I reach the shower. When I reach the shower, I have to put my hands like this and then get the hot water going, and then to be able to stretch it out and to be straight. And then when I was in this position, the pain was excruciating.
After multiple years of being told her pain was a burden that she'd have to face for the rest of her life, Margarita sought out different physicians in an attempt to reduce her pain.
I visited several doctors, visited 2 spinal specialists, pills. That's the only thing they gave me, the only hope. Then I went to get the shots in your back. And I always ask, is there a hope for this? There's surgery, no? So what does this mean? I have to live with this pain? And that's the answer they gave me, yes. There's nothing I could do.
But after a phone call one day from her brother, her life changed.
My brother is a surviving cancer patient from leukemia. He has degenerative bones from all the medicine. He could barely walk. He was in a wheelchair, and when he went to his oncologist to visit him, he said, I want you to go and see Dr. Bonati. He did surgery on me. It's incredible. You will not believe the results. It's non-invasive. You'll love it. After I saw my brother, amazing results. He did 2 surgeries on my brother. I said, I'm next. Take me.
Consultations at the Bonati Spine Institute are comprehensive and performed personally by one of our world-renowned surgeons. Once a thorough physical examination is complete, followed by an evaluation of symptoms and an extensive analysis of imagery, a surgical plan is custom-tailored to target the source of the pain.
Dr. Bonati came and saw me after he reviewed my MRI, and he explained to me, he said it's a simple surgery. We do one side first, then the second side. We'll do this procedure right here. When I walked into the surgery, I see all these big cameras, and it's not your conventional flat bed doctors have procedures in. It's like you're kind of like sitting face down, and you see the camera and you hear the doctors talking. He's continuously talking to you. Does it hurt here? Say yes or no. Do you feel anything? And I could hear them and see everything that was going on. There's moments that you kind of go a little bit of sleep, but you're totally awake and know what's going on.
The Bonati Spine Institute employs conscious IV sedation during its procedure to ensure patients remain in communication with not only their surgeon, but the rest of the surgical staff so they can make sure their pain is alleviated.
The difference between conscious IV sedation and general anesthesia is that we will be able to give patients a level of comfort using intravenous agents, but they will still be aware enough to tell us what they're feeling. And it's very important to do that. And we've been doing this method at the Bonati Institute for decades. And Dr. Bonati is the pioneer behind this all. The reason is it allows the patient to express exactly what they're feeling at that moment right on the table. There are points during the procedure where it's a little bit more intense for them as patients because they may feel more of their initial pain levels, but the whole idea is to get them to pinpoint the exact location, which is just the only way to really do this, because without that information, which is so helpful to the surgeons, patients could, leave the facility still having the same pain that they came in with. But using that technique, we usually get it. And it's without question the best way.
Because precision tools and techniques are used when performing the patented exclusive Bonati Spine procedures, time spent recovering is significantly reduced.
The recovery's been amazing, totally amazing. From the time I got home until today, from my first surgery, it's been now 3 years. I cannot believe I went through all those years with that pain. And now the things that I do, I am a person that I'm extremely active. I walk in my job 12 to 15 hours a day. I can lay down on the beach at the pool with no problem. Going home, the recuperation was just be calm, lay down, walk. Absolutely, you have to walk. You cannot just sit there. He doesn't want you to become you have the surgery and just kind of like, oh, I had this back surgery. No, you have to move. Keep moving. The more you move, the more you walk, the quicker your recuperation is going to be. Your recovery is very fast. It all depends on you.
Margarita is back to her active lifestyle and making sure her clients and resort guests are feeling just as great as she is.
There's no restriction of doing anything. The one activity that I loved to do before that I couldn't do, that I always kind of like made excuses, was to lay out at the pool or lay out at the beach or go camping or spend the night at someone's house in a regular bed. Those were activities I was not able to do. And I tell everybody, don't be scared. It's amazing. They're not putting a rod through your back. They're not putting any pins in it. They're working in this small little incision this big. When a lot of people ask me about that, they ask me about how was your back surgery. I tell them it was the best thing I ever did. The best thing I ever did. With all the procedures and all the technology that they have right now, the non-invasive procedures, this scar is this big. I recommend the Bonati Institute anytime, anywhere, to anyone. Here, in other countries where I travel, amazing. From the professionalism of Dr. Bonati, the nurses, the care. When you go there, the way they treat you from your first appointment, from the concierge when you get there. Eric, the gentleman you have to call on the phone and give a report, they call you, how are you doing? Are you feeling better? The follow-up they have is amazing. They've sent me an email like every 6 months. How are you doing? How are you feeling? I just think you should not stick to that one opinion that one doctor might give you. What Dr. Bonati has done to me and to many patients is giving us back things that we never were able to do. Gave me a hope. I was thinking I was going to be 60, 70 years old taking pills and being in pain all the time. To me, be able to work the way I do, the quality of life that I have, that I don't have to ask for 15 pillows every time I go to a hotel, that I can sleep in anywhere I want to. I can sleep on the floor if I want to, on a sleeping bag where I was never able to. It's amazing. So go with the procedure. There's nothing to be fearful about. It's a quality of life. That's all there is. It's a quality of life.